Welcome back to the Ricky Mathews Show. Appreciate you joining us. And this is Wednesday, as I said. So the second half of every Wednesday show, we have Singing River Health Talk. And we get this incredible opportunity to meet so many wonderful professionals that work at the Singing River Health System. I personally have really enjoyed it. And I was talking to someone the other day and reminded myself that that we're actually doing this for the radio and for all the social media platforms. But the truth is, I've enjoyed getting to know these folks, and it's been really, really, really beneficial to me personally, and I hope it's been beneficial to you. The feedback has been terrific. Listen, today's it's going to be an interesting subject because it's not always the most pleasant conversation to have, but the truth is, a lot of people have to deal with this. And in fact, I have to tell you that a very, very close person to me had a significant bowel obstruction that caused a perforation, and she needed really major surgery. And for a period of time, she actually had to have an ostomy. And, she eventually was able to have it converted back to normal. But it's something that not everybody, but a lot of people have to face along the way. And it's good to know that there are board certified wound ostomy professionals. And one of them is Alicia Steward, who is a board-certified wound ostomy nurse at Ocean Springs Hospital. She's actually done that for 22 years. She's been at the hospital for 30 years, and she's someone I look forward to introducing to you today. So without any further ado, let me welcome Alicia to the Ricky Mathews Show. How you doing, Alicia?
Hey, I'm doing great. Thank you for having me.
It's good to see you. You heard what I said at the beginning of the show about so many wonderful professionals. I've had the opportunity to get to know so many, and this series has been going on for weeks. And if there's something that connects every single person that I've had the opportunity to meet and introduce to the audience, it's been that they care deeply about their patients. I mean, there's a clarion call about being to addressing a patient's needs and developing a relationship with patients in a way that improves their outcomes. And you're no stranger to that clarion call, are you?
No, sir, I'm not. I do care deeply about my patients, and I try to treat every one of them like they're my family. So I've had some experience with ostomy in my own family. My father had one. That's kind of how this directed my path. And so I use that to help my patients on a daily basis.
It's interesting because whether I've talked to professionals in general or doctors, surgeons, and others, it's interesting because many of you guys have something that happened somewhere in your lives that spurred a thought that this is where you need to focus your attention, and you're no stranger to that. It was interesting to learn that you had general surgery in your background. Of course, you had colorectal surgery. And you had, you've kind of built a great foundation to eventually do the board-certified wound ostomy work that you're doing today. But it really served you well, didn't it, in your current, work, didn't it?
It has. It has. Yes, I work closely along with the colorectal surgeon here that we have, seeing his patients before surgery. So I kind of get to meet them and do some education prior to their procedure. Pick an appropriate location for their stoma, which helps in the long-term care of, the ostomy. It makes it better for them, and then work very closely with general surgery because both do the operations. But yeah, that experience has definitely benefited me. Plus, I've actually attended some of the operations, so I can actually see how they do the procedure. So that's also a bonus that, is really, really nice.
Alicia, one of the things that I've noticed, and of course, the psychological side to this, your work is as much about the mental piece of this as it is about the physical piece. But what I've noticed, for example, on Instagram, not all the time, but regularly, someone will pop up who has an ostomy, and they're basically letting people know this is not something to fear, and they talk about it. And in some respects, they share kind of their journey with people. But I think knowledge is power in this case. I think the more you learn about it, the less you fear the process. And it's really kind of, unfortunately for the folks who are involved in this, it can be a shocking turn of events in their lives. And your work is to help them embrace it and understand that they can still live a wonderful life, and you're going to show them how.
That's right. So the goal, I always tell all my patients, for them to have a fully functioning life with an ostomy. Everybody, experiences a new ostomy differently. So if it's unexpected, of course it's shocking, and we meet the patients where they're at. I don't push for them to advance to a different stage of, accepting the ostomy. So just try to help give them information, encouragement, so that they can adjust and adapt. And over time, they usually all get there where they've, learned how to take care of it. We encourage the independence. And then to see them on the other side of it, it's really, really nice. So I just kind of meet them at the phase of where they're at with the ostomy. And the support group that I have, I think, is helpful for that, because it can feel very isolating. Patients feel like they're the only one that have this. I try to teach them that there's all age groups, from young babies, adolescents, teenagers, all the way to 90-year-old patients. So in our group, we kind of share, and they can see other people that have an ostomy like them, and they all kind of just become friends and share different things that they've learned about their experience.
So let's get back to the basics. Tell us, there are different forms. So what is an ostomy?
Well, an ostomy is just like a surgically created opening that the doctor, creates if patients have different issues. So, diverticulitis, Crohn's disease, ulcerative colitis, irritable bowel. If they've had an injury, if they have an unhealing wound that requires diversion, the doctor creates a pathway for the stool to exit the body. But we do colostomies, typically ileostomies, and then they also have ostomies for urine. And those patients usually have bladder cancer. Their bladder's been removed so that they create a diversion for the urine to exit the body. So those are the three typical ones that we see.
So over the years, has there been advancements in the way that, ostomies are dealt with, and sort of the aftermath and how you live with them? Or has it been kind of pretty steady? Like, is there a new technology that's been developed and so on?
Well, as far as the procedures, they're pretty standard. The doctors, if they can, of course, these days do laparoscopic procedures, robot-assisted procedures, which those are better healing for the patients. They're less, it's not a large incision. They use the robot or the laparoscope to do those small incisions and then create the stoma. So in that instance, yes. As far as products, yes, there's an advancement in the ostomy products that we use. They have different technologies. There's a multitude of different appliances that are available. I kind of help patients navigate that based on what issue they're dealing with. Everybody's stomach's different. Their contours are different. Their stomas are different. So it's kind of hard for them to know which product is best sometimes. So that's my job, is to help them find the best appliance and help them get what they need, so that they're not worried about having supplies that are, fit well, that they don't have to change often, that don't have leaks. So yes, there's always advancements in the technology as far as the ostomy supplies go.
So, so you're certified, and we're not just talking about this is something that's tacked onto a typical nurse's day, but this is literally a program, an ostomy program at Singing River Health System. So what's part of that program? What are the various pieces of it?
Well, I got my wound ostomy continence nursing certification through Emory University in Atlanta. It's a fantastic school. Like you said, I've been doing this 22 years. So a lot of people aren't aware that it's a master's prepared program. So you have to have your bachelor's degree to apply to the school. It's very intensive. We do wound care certification, ostomy certification, continence certification. They have diabetic foot that you can do. So it kind of encompasses a lot of information. And then once you complete the course, it's usually a year-long course. You take your certification exams, and then we recertify every 5 years. So it's an intense program, but there's a lot of need for it. So I'm trying to promote some of the nurses that I feel like would be a good fit to go to school for the program, because I think there's only 3 of us for the state of Mississippi. So not a lot. It's not a profession that a lot of people are go into.
Well, it's like, I mean, obviously, when you said certification, I didn't realize how intense the program is. But you think about the wound care aspect of this, there's probably a lot to learn as it relates to that, isn't there?
Sure. Yes, there is. There's a lot of different types of wounds. We help with like dressing selection. Again, we work closely along with the doctors. They depend on us a lot to come up with a treatment plan for the patients to heal the wounds. Not only in the hospital setting, I see those patients, but we also have to make sure they have good aftercare. So after they discharge from the hospital, that we get them set up with a wound clinic to continue treatment. And we have to change the protocol of the bandages and the different types of supplies we're using based on their healing and different things like that. So it is a lot of information to have to know.
So when we get back on the other side, we're going to talk about ostomy support groups and why ostomy care matters. And if you know someone who's involved in an ostomy, maybe needing to get one or has one, maybe struggling through it, or maybe struggling through the reality of having to get one. We'll be back after this message to talk a little bit more about it. We'll see you. Welcome back to the Ricky Mathews Show from the Citizens Bank studio. We're visiting today with Alicia Steward in Singing River Health Talk. She's a board-certified wound ostomy nurse at Ocean Springs Hospital, where she's done this particular expertise for about 22 years. She's been at the hospital for 30 years. And, I noticed at the end of sort of the talking points that I got, Alicia, that ostomy can be a life-saving and life-changing. And with the right care and support, patients can thrive. Singing River's dedicated ostomy team is here to walk alongside each patient every step of the way. And when you say life-saving, you really mean that. And when you say life-changing, you really mean that too. And, part of what you're doing is helping people sort of walk through the process, learn ostomy care so that they can really get back to their routines in life, to be able to do social activities like they enjoy doing, to be able to pursue their hobbies. That's really important. I noticed that during the break, you and I chatted a bit, and you made the comment that you love what you're doing, and that passion really, really shows. But when you've helped a patient come to grips with the reality of this, and then find happiness in their lives and hope in their lives, that's got to be super fulfilling.
It is. It is. It's very rewarding. I've become good friends with a lot of my ostomy patients, and I asked them to come in and speak to our ostomy support group if they've had their ostomy reversed. But I am blessed. I'm very blessed. My goal every day is to make a difference in people's lives and share the knowledge that I have and the passion that I have for this. And I'm hoping that I'm doing that. That's what my goal is.
Well, I was surprised when you mentioned the age groups from babies to 90 years old and all points in between. So you've really kind of seen it all. So people have had to work their way through a process, of all ages. That support group that you just mentioned, that, you think about the mental side of ostomies, the support group's got to be such a critical part of this.
It is. It is. I started that back in January. I had wanted to do it before, but just, with my kids, it wasn't a good time because I typically do that after my work day. So just seeing an increase in the population that we have that are requiring ostomy surgery for cancer is the main one. And then I have a few patients that I have that are for wound healing that are paralyzed. But just felt led to start that. And since January, it's been a blessing. We continue to grow and share about it. And usually we discuss a topic. So I try to give them a little education on maybe something that they wouldn't have necessarily known or thought about. So we do a brief discussion and then we open it up to questions. If they feel comfortable, they share what type of ostomy they've had, different supplies that they use, different tips, like I said, and tricks that maybe they found that work. And it's in person. It's very intimate. And then I ask if they want me to discuss anything specific. So I'll do a presentation on that. And that's just kind of how it goes.
So you've taken the initiative to do that. That is so cool to hear. When do you meet?
We usually meet on Fridays at 5:30. We don't have a consistent schedule like every third Friday of the month because of holidays and different things. We've kind of altered the schedule a little bit. But our next meeting is this Friday on the 18th. The hospital's really good about posting on Facebook website when we're going to have it. I also post on my personal Facebook, and then all my nurse friends share it on their pages. But usually it's at 5:30 on a Friday. We have the groups booked out till the end of the year so that they can go on the website and check when it's going to be given, and then just scan the QR code and sign up. You can bring your spouse, you can bring a friend, whoever you want to come to the group.
And how many people typically attend?
I think the most I've had so far has been 14, so it kind of varies, but 14 patients, which I was really proud of that. Like I said, I like the intimate atmosphere, but I'm hoping it continues to just grow. So like Field of Dreams, I say if you build it, they'll come. So I'm hoping that it continues to grow and that I'm able to help more and more people.
So someone listening is facing an ostomy in their lives. What's your message to them?
It's going to be okay. I will say this. I always tell my patients, just the nurses that are on the floor and the nurses that are in the emergency room don't usually have the advanced knowledge for ostomy care. So sometimes it can be a little scary, especially if after they have one, they have an issue. But they do have me as a resource. Our hospital system is really good about bringing patients over to Ocean Springs Hospital. That's where I work. And I can help them navigate getting supplies. I answer questions, see them as an outpatient in the clinical setting. So there are nurses that have advanced experience with ostomy. Not that it's hard to manage, but just sometimes it can be a little intimidating to a regular nurse, and they're not quite sure what to do. So I do get called upon a lot from the home health setting and also in the hospital settings to help patients. But there are some nurses out there like me that are willing to help you in any way that you need.
Well, it's been a pleasure to meet you. And as I said, there's a level of DNA that tracks to everyone that I'm talking to from Singing River Health System. It is that you care deeply about your patients, and it shows with what you're doing as well. So, Alicia, Steward, it's been a pleasure to spend some time with you.
Thank you. Same. It's been a pleasure to spend time with y'all. Thank you for allowing me to speak on something I'm so passionate about. And like I said, my goal is to make a difference in the world. My time here, so hopefully I'm able to do that. And you airing this program will let more people know about what we have here at Ocean Springs.
Alicia Steward, one of 3 board-certified wound ostomy nurses in the state of Mississippi. We need more. This is a common problem.
Yes, we do.
And
yes,
Singing River and health systems all over. Have a great day, and we'll see you tomorrow.